in 20 minutes or less.
Yeah, tell me when I have 15 minutes. Tell me, how many people are getting old here? Those that didn't put up their hand, David, Con, and I are geriatric psychiatrists, and you can see us for your delusional disorder outside. I want you to look to your colleague to the left. Now to the right. One of the three of you, before you die, will become demented. Which one of them? Has anybody in their life been behaviorally disturbed? A few, eh? I think one of the things that's clear is that we are really at a watershed moment now, I think, in terms of making a difference in healthcare. And I would suggest to you that the tables are going to be turned, that the long-term care sector and the long-term care system is going to be the leader for the future. We have had an acute care system for some time, but that is ending. And the process and the changes that are occurring in our population, I think, reflect the kinds of things and the collective wisdom and experience that you bring in this sector to the whole health system. And I would suggest to you that if we don't meet this challenge of individuals with, as David said, responsive behaviors, we're not going to have a health system for anyone. And what I'd like to do is two things. Just characterize a little bit in regards to a bit of the environmental scan of why we're at that point, and then to share with you in the last 10 minutes a understanding and appreciation, or at least an overview, of the behavioral support system project that has been initiated here in Ontario. I used to think, how many people have got discouraged in healthcare? Yeah. The rest of you haven't? Oh, very good. Well, I think one of the things, I came out of medical school and I thought if I had a good idea, then in about 5 minutes, the whole world would change, it would be a better system. I was delusional, and then I got depressed. But I would suggest to you that we're at a point where, as Sabatier said, there's a convergence of a number of things that are occurring to enable us to make a difference at this point in time and to build on the legacy of your efforts over the years. Anybody know who this guy is? Needs a haircut just like me, eh? Insanity is doing the things the way we've always done them and expecting different results. And I think one of the things that is an opportunity here with the BSS project, we've got to find another acronym for that, the Behavioral Support Service Project, is to think about doing things in a new way. And it's really been trying, and this is why it's so nice to be here today, surfacing the knowledge, skills, and insights in the field and with the lived experience to inform where we go in terms of policy and practice. So why an emphasis on behavioral support systems? Well, one thing that we know clearly is the aging bulge. However, I would suggest to you that that's not the issue. That's part of the issue. How many people over the age of 45 do you think have a chronic illness? Do I hear 10, 10, 20, 20, 20, 30, 30, 40? No? 60? 80%. 80%. But these are individuals that might have high cholesterol, etc. But it's as we age that some of those chronic illnesses begin to take the toll in terms of changing our function and our ability to have quality of life. So it's aging, but it's also people with complexity. And certainly we know the likelihood of these chronic disorders, and it gives us an opportunity, I think, to begin to think from a preventative point of view. What kinds of things can we do that can minimize the disability associated with these? I realize there's a Tim Hortons out here and a Wendy's, and McDonald's was just down the road. I'm a bit concerned, and I think you should be too, in regards to what's happening with our society and some of the risk factors, such as obesity, etc. And I would suggest to you that we're going to see an increasing number of people, if we don't change the way that we do things, with a dementing illness at a younger age. So the boom, and I would say the echo. Essentially, we have the reason that behavioral support services has emerged as a priority is aging, but it's also dementia and cognitive impairment. How many people are familiar with Rising Tide? If you're not, it's a good read, and it suggests, in fact, in the world, every 7 seconds, a new person will be diagnosed with dementia or identified as dementia. In Canada, I think it's something like every 5 minutes, but in 2038, that will increase to every 3 minutes. And the whole issue of dementia and cognitive impairment, over 65, 3 to 5% of people have dementia, but cognitive impairment is about 20%. So I would suggest that when we talk about cognitive difficulties, we need to take our mind away from thinking just about dementia, but those disorders, changes that in fact change cognitive impairment. And has anybody heard of ALC? Yeah? Our Lynn people seem to know all about that. And the whole issue of the ALC, the length of stay, is actually very much a combination of aging, dementia, and behavior. So, a call for action. The number at risk is increasing. There's challenges across sectors. Persons and families certainly deserve a better quality experience as they walk through our health system. There are significant costs. What's kind of nice is there's recognized best practices, and there certainly is an opportunity now to leverage existing initiatives. And you'll see as I talk a little bit about the behavioral support services, I think there's a readiness for this change. So we talked a little bit about the numbers at risk, and I'm not going to go over those again, but just in terms of behavioral challenges, and David will speak a little bit more in terms of what we know as far as the number of individuals with behavioral challenges as we move forward. But we're talking not only about those individuals with cognitive impairment and behavioral challenges, but also those wonderful workers that you have in long-term care and the caregivers on a day-to-day basis that are supporting the services. And we need to improve a process by long-term care homes, and long-term care is a place to live and work that's safe and of quality. Just one thing that I just emphasized with the behavioral support service, and David alluded to this a little bit, is the system. We're not just talking about long-term care homes. We're talking about various sectors. And as you can see, in home care, 1 in 5 people that are on our public home care have dementia, and 30% of these have behavioral difficulties. Studies have come out, certainly have identified the number and percentage of challenges to nursing staff and frontline workers, and I don't think any of you here aren't aware of those sort of processes. The ALC problem, 23 days with dementia, average 10 days. Recently, a survey of Ontario hospitals identified that almost 1 in 5 are at alternate level of care, and most of those, or a good percentage of these, are waiting placement. And recent analysis of those alternate level of care individuals showed that 53% had moderate to severe dementia and 19% behavior. So this is not a problem of long-term care. This is not a problem of primary care. This is not a problem of acute care. It's a problem of care. So basically, the foundations have been, one, we certainly know an impact on individuals. We have pressures in the healthcare system. We have Bill 168. We have a number of issues in regards to issues that have arisen in healthcare that has flagged for us and highlighted the needs for looking at behavioral issues in a much more effective way. And I would encourage you to get a hold of Building Better Systems that was developed by the ministry about 2 or 3 years ago, and David will highlight some of the factors that were there that began to take a look at how we can move forward. There is, and I know in the last session that I was in, an opportunity with the Long-Term Care Act, and certainly we know within the Long-Term Care Act, for the first time that I've seen actually in any Long-Term Care Act, a issue of looking at the whole issue of responsive behaviors. And so things are shifting, things are changing.